A warm welcome to all our viewers to our series, Natural Medicine. I recently had the great honour of having a university professor from Vienna here, and I managed to have him here again today, namely Professor Dr. Kurt Schicho. Welcome, dear Kurt. Nice to see you here. Thank you, I'm happy to be here. It's a great thing for us. Last time you told us about the red light, this pulsating red light as it is used today in science, in the area of wound healing on the one hand and pain reduction on the other. Now, we talked about the pain, and today I'd like to talk to you about the wound healing. What has science already documented here? Yeah, so these two topics, if you address our previous interview, are of course not really separable because clearly wounds are very often associated with pain. We should perhaps distinguish between wounds, so fresh wounds, whether from an injury or from an operation. After every operation, the wound has to heal, or the scar has to heal after an injury. And then there's the big and very, very important area of chronic wounds. So, typical civilization diseases such as diabetes. However, there's also a great risk, namely that diabetic wounds very often last longer, and if diabetes is already very advanced, the pain sensation is just limited. So these diabetic wounds often cause little pain. But they are no less dangerous. On the contrary, there is often even a risk that if you don't check it closely, preferably daily, it can be overlooked that wounds get bigger and worse because the patient doesn't feel the pain enough. But basically, it's about two things. The point is that the wound heals as well as possible, and it's about trying to reduce the pain naturally. And in many cases, the light can do both. Can promote healing of the wound. Also, in the course of this, favourable wound healing often means more beautiful, so less visible, scars after operations, while reducing pain. I just had an experience of a family surgery. However, this technology was not actually used in surgery or in the hospital itself. I asked myself, hasn't that established itself or spread yet? Well, that's an interesting question. The application of light is very often considered to be alternative, complementary, esoteric, which is a totally wrong assessment. The use of light in medicine is not new. There's a number of scholarly publications that go into depth dealing with light, dealing with favourable effects of light. This is anything but new. We've known that for a long time. It's established. The reason why the use of light in medicine is not so self-evident, like the prescription of painkillers, is based on different things. For one, it's of course quicker to write the prescription than to apply light. On the other hand, in the past, the implementation of scientific studies was partly made difficult simply by the nature of the question. For example, if you want to do a randomized control study, a really serious study where you can clearly analyse the effect and want to distinguish whether something happens by accident or is really due to the case of the light, then it's in the nature of things difficult. In the case of wounds, for example, and also for pain, to form a control group. Because a control group would mean that I have a collective where I basically have the same wounds, same size, same location, same type of wound, but also same type of patient, so ideally identical twins with exactly the same wound. So, same participation of patients in wound care, the same drugs that the patients swallow, the same concomitant diseases, and so on. Some germ colonization on the wound, and that's difficult. How do I do that? So for this reason, it was sometimes quite difficult in the past, simply because of the question to do these randomized controlled trials. And this is exactly where we, my colleagues and I, are trying to close this gap. And that has already been very successful. And that's the good news. In short, the effect of light is beyond dispute in medicine. I also have a habilitation in biomedical engineering. I'm often busy here with the physical background of the whole thing. There is no discussion of ambiguity here. This is absolutely recognized and also proven. The hurdle were large clinical studies where you can really prove this effect with a control group. And the light certainly withstands these studies. Well, at some point, the goal should be that wherever there are operational interventions carried out, the after-treatment is carried out with light so that the wound healing is faster and the sensation of pain is less. Well, that's already practiced in part. However, a distinction must be made here in the public sector and in the private sector. Unfortunately, it's the case that the healthcare system sometimes, I'll put it a bit boldly, the increased comfort for the patient is rewarded only to a very limited extent. And this is, of course, painkillers after the operation, then the necessary operation. And those are things, thank God, our health system, which is very good in international comparison for Austria, Germany, Switzerland, finances and provides. Only if now it's a matter of tweaking things even more, doing a little more and improving comfort. It's very often the case in the public sector. At some point there are limits, simply the capacities aren't there. I understand that, but I expect from the expert to tell me, as a patient, there is something else you can rent and treat yourself, for example. Well, that is being done. This is done very successfully in the private sector. Basically in medicine, when a wound heals, it's what you want, of course, for patients. And I'm a plastic surgeon myself, and this is particularly the case with planned and not absolutely necessary interventions with aesthetic. When we do a breast correction, breast reduction, a procedure that's very common, but comes with a large scar. A tummy tuck, a big scar is inevitable. It's, of course, very pleasant for the patient if firstly, the healing is favoured, so also the swelling's reduced, the reduction of bruising, which is unavoidable after such an operation, and even the scar becomes a nicer scar. And right here is a good way to conduct such studies in plastic surgery, because symmetrical scars are very common. You often don't have that. Now, if you apply light to a normal wound after an appendectomy, you can see that it heals nicely, then it's very difficult for me, as a scientist, to prove that the good healing is due to the application of light. How would it be healed without light? I can't do the surgery twice on the same patient, that's impossible. And for two people, the wound healing is maybe different by nature. If, on the other hand, in plastic surgery, for example, we make a breast lift, a breast reduction, tummy tuck, a paniculectomy, a thigh lift, whatever, then we're left with symmetrical wounds, which are therefore largely the same on two sides. And there you can do very good studies where you treat one side with light, the other side not, and draw a comparison. But we also have, in order to place the whole thing on a solid foundation, carried out laboratory experiments, because we're always interested in the mechanisms. So not only the clinical effect is scientifically interesting for us, but also the underlying mechanisms. And there it is the case that the light has a demonstrable effect, on the one hand, on inflammatory mechanisms, but also has a clear and demonstrable effect on new blood vessel formation and tissue perfusion. Tissue perfusion means nothing more than blood flow. And of course, if I have an area that is well supplied with blood, that benefits the vitality of the tissue. This favours the formation of new tissue and the formation of a scar that is as invisible as possible. And the stimulation of new blood vessel formation could already be proven in the laboratory in a solid and well-founded manner. We've done studies here. A colleague of mine, Dr. Peter Dungle from the Ludwig Boltzmann Institute in Vienna. Well, I don't want to get too scientifically theoretical, but these so-called Huvec cells, human umbilical vein endothelial, are cells that can be used to study neovascularization. And on the other hand, to avoid animal testing, we worked with the so-called chloroalleric membrane. Now that sounds very complicated, but I'll say it clearly now. It's basically a hen's egg that's been fertilized but doesn't feel anything yet. The chicken embryo doesn't feel anything yet, it doesn't yet have a nervous system. And now, quite boldly, instead of making a fried egg, I take this egg, this membrane inside, in which the chicken embryo forms and grows and thrives. And to avoid animal testing, I'll just take this membrane that lives, that has blood vessels, and of course with that, if I take a pallet of eggs, normal chicken eggs, I can very well study the mechanisms that take place in the vascular system in the laboratory. Under controlled conditions, and that's what we did, and we're able to show significantly that the formation of new blood vessels is stimulated by light. So it's very simple to imagine. We made an assay here with a large number of membranes. These are such transparent skins where very fine blood vessels are inside, so capillaries, and one half got light every day, pulsating, repulse red light, a certain wavelength, certain frequency, cold red light, so no infrared light source. And this group, which received the light, showed after 5 days significantly, so statistically verifiable, a significantly larger number of vascular branches. You can think of it like a bush or a tree that you cut. So you cut off the branches and they sprout again. This sprouting from the branches, these branches also take place in the vascular system and lead to an improvement in tissue perfusion. Well, that's just two. There are many others. I don't want to give a theoretical lecture here, but these two examples I gave are things that have recently been demonstrated in the lab. And the light significantly creates an effect. Impressive. Now I'd like to deal with two more topics, namely, on the one hand, chronic wounds, such as those caused by diabetes. How are the empirical values for regression? And the other is very simple. A child falls, has a wound. Now the mother can take the device and put it on the wound and speed up the healing process of wound healing and reduce the pain. So it's very important to me. Naturally, in any of these situations you mentioned, a doctor's visit or evaluation is always required, regardless of the light. So with the child in this example, it's up to the mother to decide whether a visit is necessary or not. But regardless of the light, and especially with diabetes, this is a very important message. The light does not replace medical therapy. So that's very, very important. You can never say, I have a wound, I'm diabetic, take the light and save everything else. No way. The medication, the care, the wound management, the surgery, we in plastic surgery, we deal very thoroughly, very intensively with wound healing and wound treatment. So it's by no means the case that one could do everything through the light. But the light is an ideal addition. And not only calms the mind and makes you feel like you're doing something good, but this repulse application is a possibility that stands up to scientific scrutiny. Well, we first could theoretically calculate, colleagues from the Technical University of Vienna, Professor Paschke and his team, how it works. These theoretical considerations could then be verified in a laboratory experiment. And thirdly, as a third step, they were able to determine the clinical benefit directly on the patient. But not instead of medical treatment, but a supplement that's been proven to work. But I would like to rephrase my question at the discretion of the mother, of course, who sees, okay, the child will now get a bruise or small wound, put a Band-Aid on it. But it would help to do this wound healing. Acceleration with the system. Oh, definitely. Multiple mechanisms. On the one hand, the swelling is reduced immediately afterwards. This is an effect that can be seen very clearly. Even with sports injuries, with strains, with bruises, they happen very often. Ice hockey, football. So bruises, strains, effusions. Here, the light can very quickly bring about a significant reduction in swelling and a significant reduction in bruising. Then, when the skin is injured, the healing of the wound naturally goes hand in hand with a less visible, more beautiful scar and a reduction in pain. And this is also an effect that you can, for example, very clearly see in varicose vein operations. This is an intervention, even if it runs perfectly and without any complications. It's natural when doing vein stripping and lateral branchiectorays, so just removing the varicose veins. This is an operation that's always accompanied by severe bruising. It's inevitable. And here, you notice that with this light, the often livid, bluish discoloured areas very, very quickly become paler, almost like a violet shirt that hangs in the sun and grows pale. So the swelling goes down, the bruising goes down, and naturally with that, the pain goes down, which means less pain medications needed. You open more and more things, open barrels where I look in and say, well, this could be another show with you. Varicose veins would be a great topic. Now, you've mentioned breast reduction, enlargement, talked about this hype these days, which isn't always medical relevant, but has a beauty relevance. I'd also be interested in that. But I think it's very important for the viewers. Just the message, if you understand the mechanism, it's easy to use clinically. I have a proven way with this light, which is really important to emphasise. Not just because you believe in it, no placebo effect, but proven. We know the mechanisms, we can prove it in the laboratory, and we see a clinical benefit in reducing swelling on the one hand, to reduce bruising, and on the other hand, to reduce pain. And this is a household pharmacy for me. Even if you keep saying it needs to be medically clarified, that's also correct. I say that as a moderator too, but when it's urgent, on a small scale, this is a household pharmacy. Well, this effect, of course, also speaks for... It is called a household pharmacy. I like this term very much because typically, or very frequently, different problems, medical problems, can arise in a family. There are those who just have tension pains. There are those who put too much strain on their musculoskeletal system from sport. Then there are those who might have a fat cheek after wisdom tooth extraction, or the shoulder hurts. Exactly. And here you can use that very well. And then someone gets burned while ironing with an iron. It's not so bad that I have to get to the hospital, but of course it hurts a lot. The oven is also a classic. Exactly. So these are things, as you say, one can definitely use it as a household pharmacy and have one thing which has actually a confirmed effect in studies. I'd like to insert one more question, namely severe rheumatism. I mean, these are already inflammatory processes, but an inflammatory process is almost like a wound. How does the light react here? Well, there's also experience with it, with rheumatism. That's often the colloquial term for a variety of diseases. We physicians say diseases from the rheumatic spectrum. Now, I'm not an expert, I'm a plastic surgeon, but the message is even more important here. Medical clarification. First, comprehensive clarification from experts. And then, with the typical treatment of rheumatic complaints. As people know, it's sometimes the case that at the beginning, at first the symptoms even worsen a little. The body reacts, the light actually makes a reaction, and then it gets better. And that means that it's very often useful and effective to use this therapy for rheumatic complaints, because it's very important, as we mentioned, cold red light is not an infrared lamp. So we're using cold here. Infrared would be heat. Here we use a visible range of light that does not cause any heat in the tissue, because that would be unfavourable for people with rheumatism. And in that case, we have an effect that only sets in after a possible initial temporary deterioration. Well, these rheumatics who are watching right now can discuss it again with their doctor. Go there, say, "What do you think, dear doctor, of this light? If I treat myself with light, that would also be the right approach." Exactly, and especially for diabetics. These are chronic wounds that need intensive care. Very often the possibility of an operation is limited, either because of the concomitant diseases, because of the situation. I don't want to go into too much detail, but in plastic surgery we treat a lot of chronic wounds, and if something can now only be managed conservatively, so change of bandages, wound cleaning, wound hygiene, especially here, the light is an ideal complement, where we often see incredible progress in healing without negative effects. But can the viewer assume that when they go to their specialist, they go to their doctor, that they know this technology? Well, we doctors are of course always encouraged to continue our education, and that's why I'm pleased to have the opportunity to speak here. There's a wide variety of devices. However, currently in Europe, the medical device laws are extremely strict. As a scientist and member of the Medical University in Vienna, I of course think this is right and important, and I endorse that. The legal regulations are extremely strict, and this means that if something is a medical device, then it has to go through a large number of tests. You can't just put that on the market and produce a nice, glossy brochure. It really has to go through a long process and demonstrate safety and effectiveness. And there's currently in Europe, well, I don't want to advertise, but only the Repulse company. You can easily find it, which has this approval according to the current strict regulations. We also have research projects here, so I'm very closely involved there, and in these studies too, you know, after all, university research is cost-intensive. And it's also necessary to set up corresponding research projects. This usually always takes place in cooperation with the industry. And of course, industry then also uses these research projects to be able to present the results as part of the approval process. And therefore, this is not a negative thing. It's often criticised that there is a close connection between science and industry. It's absolutely fine. It's just important to be transparent about it. And this is also stated in the publications. But that is, of course, an enormous effort that many manufacturers cannot make. A light source can be built relatively quickly. Only if you now order any light source on the internet, there are hundreds that you can order. Then I don't have a medical product, and maybe no effect at all. Well, that's exactly what it's about. Light will harm in rare cases. But an effect that is really confirmed, where they say it is a medical product that stands up to scrutiny. You must have a certified medical device for this. And like I said, you mentioned the doctors if they know about it. I've noticed I also have a private practice, and more and more patients, especially in recent years, inform themselves. They do their own research, especially in the case of illnesses that cause suffering. Not so much the child who has a small scratch that heals after a few days, but people with chronic wounds, with rheumatic complaints, with joint problems, or people who train for a long time and therefore take painkillers again and again. They're very concerned about it. What alternatives do we have? So the therapists, doctors who are also watching or are spoken to by the patients, they could now find out more about this device from you at the University in Vienna via publications or directly from the manufacturer. Well, the publications can be found in all databases, in the normal medical databases. PubMed, Medline, they're there. And if you do some research and get further training, I also give lectures a lot if you're interested. And I don't think it's bad if patients ask questions themselves. I'm not a friend of Dr. Google, that patients simply go online and know everything. Whether it's a wound or a pain, that requires a holistic view. So, a wound isn't just a phenomenon that you look at locally. Here is a wound, and this or that therapy should be done, but a wound should be viewed comprehensively. Why does the wound happen? If someone falls while playing sports and has abrasions, well, then that's quite clear. But if a chronic wound heals with a delay or heals unexpectedly slowly, then you have to get to the bottom of it. How does this happen? Does the patient have comorbidities? What's behind it? Why is it happening? And this is where the medical clarification is crucial. This is where you need to think and investigate comprehensively. And that's why I'm not a fan of just going online, but vice versa. It makes perfect sense, and I welcome the fact that patients also inform themselves. How can you further promote wound healing? And then you get to the pulsating light relatively quickly. I think the future is probably going to be that these medical professionals just have devices like that, and they could be rented to patients for faster wound healing or to reduce a sensation of pain. I think that's a dream situation. Just a small correction, it's not just the future, it's actually the present. You can rent it, you can buy it. It's basically available and legal. The airtime is over again. Thank you very much for this valuable information directly from the source. What an honour for me. Thank you very much, dear Professor Doctor. I say everything in the correct order, Kurt Schicho. Thank you very much. And you too, dear viewers. I very much hope that today's programme will also seem very valuable to you, because we can produce such an effect with red light. It's scientifically documented, not just any, but medically approved red lights by the manufacturer. And we can accelerate wound healing and reduce the sensation of pain. Then I think that's something that's incredibly important. So that's it for today. Thank you very much for watching. See you next time.